and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. When medical emergencies like cardiac arrest happen around a person, it's important to be prepared. If you're aware and informed, then you can take steps to revive a person and save his or her life. Raising public awareness and understanding of practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you better understand the role of CPR. We're joined by Dr. Ashish Jaiswal, Director of Cardiology, Apex Hospital and Cardiac Clinic, Varanasi; Dr. Deepesh Kothari, Consultant Interventional Cardiologist, V1 Hospital, Indore; and Dr. Somnath Mukhopadhyay, Consultant Interventional Cardiologist, Howrah. Thank you so much, doctors, for joining us on the program to raise awareness about this very important issue. Dr. Jaiswal, first to you, what is coronary artery disease, and does this disease then lead to a sudden cardiac arrest?
Gargi, if you talk of coronary artery disease, coronary arteries are the blood vessels which supply blood to our heart. And whenever there is obstruction to the flow of these coronary arteries, then the blood supply of heart is compromised. And this we say coronary artery disease. And if we talk of relation of sudden cardiac arrest and the coronary artery disease may cause myocardial ischemia, which can cause heart attack, which can cause heart failure, which can cause cardiac arrhythmia, and all three of them can manifest as a sudden cardiac death. So there is a very important link between the coronary artery disease and the sudden cardiac arrest.
All right, Dr. Kothari, how long does it take for coronary artery disease to develop, and what are the causes of this disease?
Yeah, good afternoon, everybody. Basically, coronary artery disease is a multifactorial disease, and you are be surprised to know that coronary artery disease develops as early as in a newborn child. Rather, if you are able to see the coronaries of a child, you can see a fibrofatty plaques even if it is the age of 6 months. So the development of coronary artery disease develops so early, rather before the arrival of symptoms, we can see the plaque in the coronary arteries as early as 10 years before the symptom arises. So the coronary artery disease is a multifactorial disease and it can manifest even at an early age. Regarding the causes of the coronary artery disease usually is caused by build-up of a fat in the coronary artery disease, in the coronary arteries. That is known as atherosclerosis. And there are a number of causes for this multifactorial disease. The main causes for the coronary artery disease are the smoking, the high blood pressure, high cholesterol, the diabetes. You will be surprised that diabetes increases the chances of coronary artery disease by almost 4 times. Lack of exercise, stress factor, obesity, even sometimes underweight is also a cause of coronary artery disease. So obesity as well as being underweight is also a cause of coronary artery disease. Family history of coronary artery disease is one of the risk factors. So there are multifactorial causes for coronary artery disease, and one should be very cautious regarding this coronary artery disease because the symptoms for the progression of the coronary artery disease may take time and even they take decades to develop. So we should be aware for this coronary artery disease as early as possible in our lifestyle.
Right, a very important point there, to be prepared and to be aware about this. Dr. Mukhopadhyay, while not all heart problems have the same symptoms as depicted in movies, there are certain indications, however, that are worth noting and scheduling a doctor's appointment. How does someone know if he or she has a heart problem?
Good afternoon, everybody. Good afternoon, respected colleagues. As Dr. Kothari told, there are some risk factors, and after these risk factors, there are certain symptoms which can indicate the heart problem, underlying heart diseases like chest pain, central oppressive chest pain, which is exertional, that can indicate a coronary artery disease underlying. That means the arterial disease of heart, supplying heart. Next is shortness of breath, dyspnea, we used to call. That is respiratory distress on exertion, and that can there may be some heart failure situations underlying. Next is palpitation, undue palpitation, which can indicate rhythm abnormality of the heart. Next is leg swelling, undue fatigue. Another important thing is recurrent blackout episodes, which is important and which can indicate underlying electrical blockage of heart, like complete heart block, electrical blockage. So these are the common symptoms when we should suspect underlying heart disease and we should consult our cardiologist.
All right, Dr. Jaiswal, what is cardiac arrhythmia? Which type of arrhythmia is the most serious?
Okay, if you talk of our heart, in normal condition, our heart is working in a rhythm of contraction and relaxation. So that we recognize as a beat of the heart, and there is a regular interval between the heart beating. In a normal person who is an adult, heart is beating with a rate of between 100 to 60. And when we exercise, it can go up to 130, 140 beats per minute. And when this rhythm of contraction of the heart is lost, then we call it arrhythmia. It may be a slow beating heart when heart is beating with a slow rate, which we call it bradyarrhythmia. It may be a fast beating heart, when we call it tachyarrhythmia, when heart is too fast, or heart may be beating irregularly. So any of the arrhythmia can present as in palpitation, breathlessness, pre-syncope, or loss of consciousness, or sometimes cardiac arrest as well. If you talk in contrast to the sudden cardiac arrest, ventricular tachycardia or ventricular fibrillation are the most notorious type of cardiac arrhythmia. And another relatively uncommon but still notorious type of arrhythmias are bradyarrhythmia asystole. So for most practical purposes, VT, VF, ventricular tachycardia or ventricular fibrillation are the most common type of arrhythmia which are responsible for the sudden cardiac arrest.
Right. Now, Dr. Kothari, what steps should a bystander follow if he or she recognizes that someone, around them is having a cardiac arrest?
Yeah. Gargi, it's $1 million question. And rather, there are three different words with three different meanings. One is angina, second is heart attack, and third is cardiac arrest. Basically, you are speaking about cardiac arrest. But for that to understand, we need to understand the three words: angina, heart attack, and cardiac arrest. In simple words, if you are driving a car and if somehow you are driving it slowly because of traffic, it is known as angina. So angina is basically not a cardiac arrest. If somehow the car is stand still, but still the engine is working, it is known as heart attack. And if engine is not working, it is cardiac arrest. So in cardiac arrest, the heart stops beating. The heart is stand still. That is known as cardiac arrest. And for this cardiac arrest, CPR is the life-saving technique, that is cardiopulmonary resuscitation is the life-saving technique that is used in cases of cardiac arrest. And the American Heart Association recommends the chest compression for this cardiac arrest. If anybody who is trained in CPR, they provide hands-only CPR, that is, they do uninterrupted chest compression for 100 to 120 minutes until the paramedics arrives. And if somebody is trained for this CPR, they keep on checking the pulse and breathing. If pulse and breathing is not there for 10 seconds, then they start chest compression. What they do, they give chest compression for 30 times and then they give the breathing, rescue breathing bar for around 2. So CPR is the technique that the bystander should know in cases of cardiac arrest. And CPR basically keeps oxygen rich blood from flowing to the brain so that the other organs, they get the supply of the oxygen properly by this CPR.
All right.
Somehow, yeah.
All right, so those are the, what one must do. But Dr. Mukhopadhyay, if you could also explain to the viewers the process of CPR and how it should be done, because that's also very important, the way it is carried out.
Yes, of course. The actually CPR, cardiopulmonary resuscitation, is a life-saving skill of chest compression. Initially, it was told that the procedure should be ABC, airway breathing circulation, but nowadays it has been changed to CAB, compression, airway and breathing. So compression, chest compression is the fundamental thing, and one having cardiac arrest, first thing is make sure that the patient is lying on a flat surface. After that, you start compressing the chest, center of the chest, with heel of your one hand and other hand above it, interlocking the fingers. Elbow should be straight, absolutely, and you start compressing at around 2 inch or 5 centimeter depth, with time to give the chest to recoil again, to come again in its original position. And if assisted, there is important thing is no checking should be done if the person is not trained. For trained person, 2 minutes, after 2 minutes assessment is there. But if the person is not trained, so keep on giving CPR. And for breathing, assisted breathing, if the airway is secured, then you can give one breath in 6 seconds. So 10 breaths per minute. Otherwise, 100 to 120 compression per minute is must, and kneel down beside the patient, start compressing with interlocking fingers, both hands and center of the chest with your elbow straight. So that is the basic technique of chest compression.
All right, Dr. Jaiswal, we were speaking about CPR, and though your intentions are correct, sometimes wrong or half knowledge can also be dangerous. So explain to our viewers, when should one not perform CPR?
Okay, if we talk of CPR, it is as Dr. Kothari said, engine has stopped, heart is not working. So do whatever you can do. There is no harm, because if you are not able to restart your engine, if your heart is not able to restart, then person is gone. So if you see practically, there is no contraindication for doing CPR. The thing is that if when you have started the CPR, or when the lay person has started the CPR, and if you feel that person is awake or he is responsive, you should stop doing CPR, because this is an indication that his rhythm has come back, his heart has come back, and patient is awake. And another only one absolute contraindication for doing CPR is that if some person is terminally ill, or there is someone's wish that I should not be resuscitated if I have had an arrest. That is, do not resuscitate wish of a particular person or particular patient, then that is the only contraindication for not doing CPR.
All right, so that's important to keep in mind, and all these are, issues that need to be, there needs to be more awareness about it in the country. We'll slip into a short break and return with more questions for the doctors. Stay with us. Welcome back to Health and Wellness. We're talking about the need to be aware of the early signs and symptoms of cardiac arrest, and also be trained on giving CPR if the need arises. Let's go across to Dr. Kothari. And Dr. Kothari, what can happen if too much air gets into the stomach when someone is performing CPR?
Yeah, that's a good question. CPR is the technique basically everybody should know. But sometime by performing CPR, instead of the air going into the trachea via the trachea to the lungs, sometimes the air goes into the stomach, and we know the stomach is like a balloon. It blows up to a point and then collapses. So much if air enters into the stomach, it will collapse, and this collapse may cause vomiting and it will cause the mass. But more seriously, what happens if the content of the stomach goes into the airway? It will cause airway blockage, and sometimes it may lead to pneumonia, and it may even cause death. So in spite of giving CPR, you are landing up in a mess. It also causes increase in intrathoracic pressure, and it causes decrease in coronary perfusion. And so instead of increasing the survival, we are rather decreasing the survival of the patient. So much air in the stomach is a deleterious for this cardiac arrest patient.
All right, Dr. Mukhopadhyay, how important is it for the caregivers and family members to learn CPR, especially those who have a family member suffering from heart disease?
Yes, actually caregiver must know, or family members of chronically ill patients must know the proper technique of CPR, because of the fact that the most of the cardiac arrest events used to occur out of hospital situations. So one patient who is suffering from chronic heart failure or any chronic condition, chance of having cardiac arrest during homestay, that is much more, and timely CPR in that patient during cardiac arrest situation can save one's life or can buy some time for further management, for further advanced management. If the patient is suffering from, say, if the patient is suffering from any dilated cardiomyopathy like condition where heart gets bigger and he is having VT, ventricular tachycardia and cardiac arrest. So at this situation, giving a CPR that can save one's life at that time. After that, he can go for further management. So that is very important for family members also to know the thing.
Right, Dr. Jaiswal, is it possible to lead a normal life after cardiac arrest?
If we talk of survivors of the cardiac arrest, that who survive a cardiac arrest, good intensive evaluation of the cause should be done. And if we are able to identify the cause, like if patient has an VTVF or arrhythmia, we can go for an ICD implantation, that is implanted cardioverter defibrillator. Or if patient is having coronary artery disease, that can be taken care of by the means of bypass surgery or angioplasty. Or there are cardiomyopathies, then adequate medical therapy can be given. So if we can identify a cause of cardiac arrest, then obviously a patient, if he remains in a cardiologist care with a good compliance to the medical advice, he can lead a normal life.
Right. And Dr. Kothari, what type of diet should people be following, if they have heart disease?
Yeah, prevention is always better than cure. That is a universal, everybody knows that. And rather we discuss everything with our friends, families regarding our cars, our house, our financial status, but we never discuss regarding our health, regarding our diet, what diet we should follow. And that is the main thing that we should concentrate, what diet we should follow for to prevent the cardiac disease. So you will be surprised that every 10 patients, out of every 10 patients, one patient is having cardiac disease. So by diet, we can decrease it by almost 50%. So what diet we should follow? The diet should be less of sugar. Less sugar, less chances of cardiac disease, less saturated fats and fast food. It should be avoided in the diet. We should have a variety of foods that contains green leafy vegetables. And so we should invest in our diet rather than investing in other things a bit also. If you have a habit of drinking, you should curtail it to a limit. Be physically active. At least you should physically active for at least 30 minutes in a day. Maintain a desirable weight. You should consume less amount of tobacco, even say no to tobacco. That are the little things that you can include in your diet so that you will prevent from the cardiac disorders. So the balanced diet, the diet full of vegetables, fruits, avoid saturated fats, avoid non-vegetarian foods, avoid too much saturated fat in the diet.
All right, so we've talked about, the diet, but Dr. Mukhopadhyay, while we say that, the diet and exercise, if you could tell us what kind of exercises should be avoided if you have problems with your heart, because that's as important as, exercising and keeping fit.
That is the most relevant question nowadays after having this type of death we have seen in our celebrities. The most important thing that exercise should be done in a case of cardiac disease, and the exercise should be aerobic exercise and resistance exercise. Too much isometric exercise are to be avoided, like too much push-up, too much sit-up. These are to be avoided. But keeping your body weight less, keeping your body weight, healthy body weight, not to be overweight, it is very important to go for exercise regularly. And exercising during very hot weather, very cold weather, these are to be avoided. And one more thing is, one should consult his or her cardiologist when he or she start experiencing undue fatigue or respiratory distress during the exercise he or she used to do. So that is important, that regular exercise with excess fatigue, excess respiratory distress, that is important, and one should consult his or her cardiologist also. And again, too much fatigue, too much respiratory distress during exercise, it should be avoided. And last but not the least thing is, if there is family history of two important diseases like HOCM and ARVD, these are the genetic diseases where there is a chance of sudden cardiac death, then exercise, before having heavy exercise, one should know his or her status if there is family history. So these are the, more or less, these are the things. And male preponderance of these deaths are there. This is perhaps, there are lots of factors, like males are prone to, in any gym, number of male are more than female. And the other factors are male preponderance of these genetic diseases of having sudden cardiac arrest. These are the important things for exercise and heart.
All right. Well, thank you so much, doctors, for speaking to us and answering all the questions on this important issue of heart health, and also the need to know CPR so one is not just a bystander but can actually save a life. Thank you so much, and thank you all for watching at home. Goodbye.